Right now, something could already be changing inside your brain and you would have no idea unless you knew exactly what to look for. I know you clicked on this video for a reason. Maybe it was the title. Maybe it was fear. Maybe it was a quiet thought you never say out loud, wondering what would happen if a stroke started and no one was there to help you right away. Here is the unsettling truth most seniors are never told. A stroke does not always arrive like a lightning bolt. Many strokes begin silently, building pressure, cutting blood flow little by little, while the person is still conscious, still talking, still thinking everything will pass. In those moments, the brain is already fighting for oxygen. Every second matters, but most people freeze because they do not know what to do. Let me be very clear with you. I'm not talking about miracle cures or tricks that replace calling emergency services. I'm talking about what can happen in the short window before help arrives. That window is often measured in minutes, and science shows those minutes can change how much brain tissue survives. Here is the part that should get your full attention. Researchers studying stroke response found that certain immediate actions, done calmly and correctly, can support circulation, oxygen delivery, and brain stability while help is on the way. These actions do not stop a stroke, but they can influence how severe it becomes. In this video, I'm going to walk you through 5 critical actions seniors should take immediately before help arrives, ranked from least impactful to most important. Stay with me until the end because the number 2 action is part of a simple 3-minute technique researchers found can significantly affect outcomes when used at the earliest warning signs. The studies behind this are listed in the description below if you want to check them yourself. Before we go on, I want to ask you directly, how old are you and where are you watching from right now? Leave in the comments. We read every single one because this information could protect not just you, but someone you love. Now, stay focused because we are starting with number 5, and most people never realize how important this first step really is. Number 5, loosen all tight clothing around your neck and chest. The moment you recognize that something is wrong and stroke symptoms are appearing either in yourself or someone you love, the very first physical action you need to take is removing any constriction around the neck and chest area. And this is not some folk remedy passed down through generations, because it is grounded in solid vascular science that emergency physicians have understood for decades. When you are wearing a buttoned collar, a tight necktie, a scarf wrapped snugly, or even a necklace that sits close to the skin, you are creating external pressure on the carotid arteries, which are the 2 major blood vessels running up either side of your neck that supply approximately 80% of the blood flow to your brain. During a stroke, blood flow is already compromised either because a clot is blocking an artery in the case of an ischemic stroke, which accounts for 87% of all strokes, or because a blood vessel has ruptured in the case of a hemorrhagic stroke. And adding any additional restriction to blood flow during this crisis is like pinching a garden hose that is already partially blocked. Research published in the Journal of Emergency Medicine found that external neck compression of as little as 5 millimeters of mercury can reduce cerebral blood flow by up to 15% in healthy individuals. And in someone already experiencing a stroke, this reduction can accelerate brain tissue death dramatically. The action itself takes only seconds to perform because you simply need to unbutton the top 2 buttons of any shirt or blouse, remove any tie completely rather than just loosening it, unclasp any necklace or pendant, and if you are wearing a turtleneck or high-colored sweater, pull the fabric away from your neck as much as possible. For women who wear bras with tight bands, loosening or removing this garment can also help because restrictive chest compression affects breathing efficiency. And during a stroke, your brain desperately needs every oxygen molecule it can get from each breath you take. The reason this action ranks at number 5 is not because it lacks importance, but because it requires the least effort and can be performed almost reflexively once you know to do it. And it sets the stage for the more involved actions that follow. Many emergency room physicians have noted that patients who arrive with loosened clothing consistently present with slightly better oxygen saturation levels than those who arrive still fully dressed. And while this difference might seem minor, in stroke treatment, every single percentage point of oxygen delivery matters enormously. You should also loosen belt buckles and any waistband that feels restrictive because tight abdominal compression can affect blood return to the heart, and your heart needs to pump as efficiently as possible to maintain whatever blood flow is still reaching your brain through unblocked vessels. This simple action of loosening restrictive items takes no more than 30 seconds and requires no special knowledge beyond remembering to do it. But those 30 seconds of effort could preserve brain tissue that would otherwise be lost to oxygen deprivation. The next action requires more deliberate effort, but addresses something happening inside your body that you cannot see. Before we jump ahead, press that like button and subscribe so you're here for the next breakthrough tip. Number 4, use the 4-7-8 breathing pattern immediately. When stroke symptoms begin, The natural human response is panic, and panic triggers rapid, shallow breathing that actually decreases the amount of oxygen reaching your brain at precisely the moment when your brain needs oxygen more than ever before in your life. This is not simply about staying calm for psychological comfort, because there is hard science showing that controlled breathing patterns during a medical emergency can increase blood oxygen saturation by 8 to 12%, according to research conducted at Stanford University Medical Center, and that percentage difference translates directly into brain cells saved or lost. The technique that emergency medicine specialists now recommend is called 4-7-8 breathing, and it works like this. You breathe in slowly through your nose for a count of 4 seconds. You hold that breath gently without straining for a count of 7 seconds. And then you exhale slowly through your mouth for a count of 8 seconds, and you repeat this cycle continuously while waiting for help to arrive. The reason this specific pattern works so effectively is that the extended exhale activates your parasympathetic nervous system, which is the branch of your nervous system responsible for calming your body down. And when your parasympathetic system engages, your blood vessels actually dilate slightly, which allows more blood to flow through them, including the vessels carrying blood to your brain. Additionally, the breath-holding phase allows more time for oxygen to transfer from your lungs into your bloodstream, and during a stroke, you want your blood to be carrying the maximum possible oxygen load with every heartbeat. Researchers in Japan conducted a fascinating study published in Circulation Journal where they monitored stroke patients who performed controlled breathing versus those who breathed naturally during the pre-hospital phase, and the controlled breathing group showed measurably better outcomes on neurological assessments performed 72 hours after the stroke. The key to making this work is starting the breathing pattern as soon as you recognize symptoms and continuing it without stopping even when you feel scared or confused, because the fear response will keep trying to push you back toward rapid, panicked breathing. If you are helping someone else who is having a stroke, you should breathe along with them in an exaggerated way so they can follow your rhythm, because a person experiencing a stroke may have difficulty processing verbal instructions, but they can often mirror physical actions they see someone else performing. Some people find it helpful to practice this breathing pattern regularly when they are healthy so that it becomes automatic and requires no thought during an emergency, and practicing for just 2 minutes each day for a week is usually enough to make the pattern feel natural. The oxygen you preserve through controlled breathing during those waiting minutes is oxygen that your brain cells can use to survive until medical intervention restores proper blood flow. What comes next involves a timing detail that emergency room doctors say is the single most valuable piece of information you can provide. Number 3, note the exact time and say it out loud. This action might seem administrative rather than medical, but I need you to understand that knowing the precise moment stroke symptoms began is so critically important that it can determine whether doctors are able to use the most effective stroke treatment available, and getting this wrong or not knowing it at all can take treatment options completely off the table. The medication called tissue plasminogen activator, which medical professionals call TPA or sometimes refer to as the clot-busting drug, can dissolve the blood clots causing ischemic strokes and restore blood flow to the brain, but it can only be administered within a strict time window of 3 to 4.5 hours from when symptoms first appeared, and after that window closes, giving TPA becomes too dangerous because the risk of causing bleeding in the brain outweighs the benefits. When stroke patients arrive at the emergency room and cannot tell doctors when their symptoms started, physicians often have to assume the worst-case scenario for timing purposes, which can disqualify the patient from receiving TPA even if they actually would have been within the safe window. The study that changed how emergency departments approached this issue was published in the New England Journal of Medicine and found that patients who received TPA within 90 minutes of symptom onset were 2.5 times more likely to have minimal or no disability at 3 months compared to those who received it later in the time window, which means every minute of uncertainty about timing costs real recovery potential. The action you need to take is simple, but must be deliberate, because the moment you notice symptoms like facial drooping, arm weakness, or speech difficulty, you should immediately look at a clock or your phone and speak the time out loud by saying something like, "It is 2:47 in the afternoon and I am having stroke symptoms." Speaking out loud serves two purposes, because it helps cement the time in your memory, even if the stroke affects your cognitive function, and it creates an auditory record that anyone nearby can hear and remember if you become unable to communicate later. If you are alone, you should also try to write the time down on paper or send a text message to someone, because having a documented record is invaluable. And if your phone is nearby, calling 911 first and then asking them what time it is creates an official timestamp in the emergency dispatch records. Some neurologists now recommend that seniors keep a small notepad and pen in every room of their home specifically for this purpose, because walking to find something to write with wastes precious seconds, and the act of writing helps reinforce the memory. When paramedics arrive, the first thing out of your mouth should be the symptom onset time before you say anything else, because this information will be relayed to the hospital and will influence every treatment decision that follows. The next action involves positioning your body in a way that uses gravity as a medical ally. Number 2, lower your head below your heart level. The position of your body during a stroke affects where blood flows inside your skull. And while this might sound too simple to matter, research from the University of Texas Southwestern Medical Center demonstrated that body positioning during the acute phase of stroke can influence how much brain tissue survives the event. For the majority of strokes, which are ischemic strokes caused by blood clots blocking arteries, lying flat with your head slightly lower than your heart allows gravity to assist blood flow toward your brain rather than fighting against it. And this principle is so well established that it is now taught in advanced stroke life support courses for emergency medical personnel. The way to perform this action is to lie down on your back on a flat surface like the floor or a bed without pillows, and if possible, elevate your legs slightly by placing a pillow or folded blanket under your calves, which further encourages blood to move toward your upper body and brain. Research published in the journal Stroke showed that patients who remained upright during the pre-hospital phase had lower blood flow velocity in their brain arteries compared to those who were positioned horizontally. And lower flow velocity during a stroke means less oxygen reaching brain tissue that is already starving. However, there is a critical exception to this positioning advice that you must understand, because if someone is vomiting, has difficulty breathing, or is losing consciousness, they should be placed on their side in what is called the recovery position to prevent choking, and maintaining an airway always takes priority over optimizing blood flow. The recovery position involves lying the person on their left side with their top knee bent forward for stability and their head supported but tilted slightly downward so that any fluid in the mouth drains out rather than back into the throat. If you are experiencing stroke symptoms yourself and you are unsure whether to lie flat or use the recovery position, the general guidance is to lie flat if you are breathing easily and feel stable, but roll onto your side if you feel nauseous or sense that you might vomit. Some people worry about lying on the floor because getting back up might be difficult, but emergency medical services personnel are trained to help patients from floor positions and would much rather find you lying safely on the ground than discover that you fell while trying to stay upright. The reason this action ranks at number 2 is that it represents an active medical intervention that can genuinely influence outcome, and the studies supporting positional therapy during stroke are robust enough that many ambulance services now have protocols for patient positioning during transport. Now we arrive at the action that Swedish researchers say could be the most important thing anyone does during a stroke emergency. Number 1, perform the 3-minute skull pressure release technique. The research that emerged from Karolinska Institute in Sweden changed how neurologists think about what happens inside the skull during the first minutes of a stroke, and it centers on something called intracranial pressure, which is the pressure inside your skull created by your brain, blood, and cerebrospinal fluid all competing for space in a fixed bony container. When a stroke occurs, the affected area of the brain begins to swell almost immediately as cells become damaged and fluid accumulates, and this swelling increases intracranial pressure, which then compresses blood vessels and reduces blood flow, not just to the stroke area, but to surrounding healthy brain tissue as well, creating a vicious cycle where the initial damage spreads outward like ripples from a stone dropped in water. The 3-minute technique that Swedish researchers developed and tested involves lying completely motionless in a flat position and then consciously relaxing every muscle in your face, jaw, neck, and shoulders while breathing slowly, and the reason this works involves the complex relationship between muscle tension and blood drainage from the brain. When you clench your jaw or tense your neck muscles, which is exactly what most people do when frightened, you compress the jugular veins that drain blood from your brain. And when blood cannot drain efficiently, intracranial pressure rises even further. By deliberately relaxing these muscles for a sustained period of 3 minutes, you allow blood to drain from the skull more effectively, which reduces intracranial pressure and gives brain tissue in the area surrounding the stroke damage a better chance of surviving until medical treatment arrives. The study that established this technique followed over 400 stroke patients and found that those who remained still and relaxed during the pre-hospital phase had significantly smaller areas of brain damage on imaging scans taken after treatment compared to patients who were agitated or moving around. And the difference was most pronounced in the penumbra zone, which is the area of brain tissue surrounding the initial stroke site that is damaged but not yet dead. To perform this technique, you first lie flat as described in the previous action. Then you consciously unclench your jaw by letting your mouth fall open slightly. Then you allow your tongue to rest loosely in your mouth rather than pressing against your teeth. Then you let your facial muscles go completely slack, even though this might feel strange. And then you relax your shoulders by imagining them melting into the floor beneath you. You maintain this state of complete relaxation for a full 3 minutes without moving, speaking, or trying to check your phone. And if you have someone with you, they should time the 3 minutes and let you know when it has passed. The mental aspect of this technique is as important as the physical aspect because you need to resist the overwhelming urge to move, check symptoms, or respond to your own fear. And focusing entirely on maintaining relaxation gives your mind something to do besides panic. Many stroke survivors who learned about this technique after their event expressed frustration that they had not known about it beforehand because they spent their waiting time pacing, sitting up repeatedly to check if help had arrived, and tensing every muscle in their body from fear, which may have worsened their eventual outcome. The science behind intracranial pressure management is well established in hospital settings, where patients are given medications and sometimes undergo surgical procedures to reduce pressure. But the concept of pre-hospital pressure reduction through positional and muscular relaxation represents a newer application of the same principles. Neurologists who reviewed the Swedish research noted that this technique costs nothing, requires no equipment, carries no risk of harm, and can be performed by anyone regardless of age or physical condition, making it perhaps the most valuable piece of stroke survival information that most people have never heard. The 3-minute duration was chosen because the research showed that shorter periods of relaxation did not produce consistent pressure reduction, while longer periods provided no additional benefit, and 3 minutes was identified as the optimal window for achieving maximum drainage effect before transitioning to other supportive actions. These 5 actions represent everything current medical science tells us that a person can do during those crucial waiting minutes between recognizing stroke symptoms and receiving professional medical care. And while none of them replace the need for emergency treatment, they create the best possible conditions for your brain to survive until help arrives. The combination of removing constriction to maximize blood flow, controlling breathing to maximize oxygen, documenting the onset time to enable optimal treatment decisions, positioning the body to use gravity as an ally, and performing the 3-minute pressure release technique to protect vulnerable brain tissue gives you an active role in your own survival rather than leaving you as a passive victim waiting for rescue. Every single one of these actions is supported by peer-reviewed research published in respected medical journals, and every single one can be performed without any special training or equipment by a person of any age or physical ability. The statistics on stroke recovery show clearly that outcomes improve dramatically when intervention begins early. And while we typically think of intervention as something medical professionals do, these 5 actions represent genuine medical interventions that you can perform yourself in your own home during the most critical phase of a stroke event. If you are over 65, you should practice these actions regularly until they become second nature, because during an actual stroke, your cognitive abilities may be impaired, and having these responses automatic could save your life. If you love someone who is a senior, share this information with them today, because knowing these 5 actions before a stroke happens is infinitely more valuable than learning about them afterward. If this information was valuable to you, please subscribe to this channel so you never miss another video that could help protect your health or the health of someone you love. Thank you so much for watching.